This nursing mindset video is about medications for gastrointestinal disorders. Today's nursing mindset is this: every bowel medication has a purpose, but every medication also has a risk. As nurses, our job isn't simply to know what a medication does. We need to understand when it's appropriate to use it, when it isn't, and what we should monitor after it's given. Let's start with antiemetics. Although these medications don't treat bowel elimination directly, they are commonly used in patients experiencing nausea and vomiting. One thing many antiemetics have in common is that they can cause drowsiness, so always think about patient safety and fall precautions. Promethazine, or Phenergan, is commonly used for post-operative nausea and motion sickness. Remember that it has anticholinergic effects, so it should be avoided in patients with glaucoma, and it can also cause photosensitivity. Ondansetron, or Zofran, is one you'll see frequently. The key point to remember is QT prolongation. If your patient has a history of prolonged QT interval, this medication will require extra caution. Finally, metoclopramide, or Reglan, promotes gastric motility and is often used for chemotherapy-related nausea. The major nursing concern is extrapyramidal symptoms, or EPS, especially in children and older adults. If you notice abnormal or involuntary movements, notify the provider promptly. Next are antidiarrheals. Our primary medication here is loperamide, or Imodium. Its job is to slow intestinal motility, giving the bowel more time to absorb water and produce a more formed stool. However, remember that not all diarrhea should be stopped. If diarrhea is caused by an infection, slowing the bowel can actually keep the infectious organism in the intestines longer. Always think about why the patient has diarrhea before giving the medication. Now let's talk about laxatives. Although these medications all treat constipation, they work in different ways. Bisacodyl Dulcolax is a stimulant laxative. It increases peristalsis, making it effective for short-term constipation and bowel preparation. Because it stimulates the bowel, it may also cause abdominal cramping, and overuse can lead to dependence. Facilium, or Metamucil, is a bulk-forming laxative. Think of it as adding fiber to the stool. The most important nursing consideration is fluids. Without enough water, Facilium can increase the risk of an intestinal obstruction. It can also decrease the absorption of medications such as warfarin, aspirin, and digoxin, so timing does matter. Docosate sodium, or Colace, is a stool softener. A common misconception is that it stimulates the bowel. It doesn't. Instead, it allows water and fats to mix with the stool, making it softer and easier to pass. Remember to administer it with a full glass of water or juice. Finally, polyethylene glycol, or Marilax, is an osmotic laxative. It works by drawing water into the bowel to soften the stool. Because of its mechanism of action, maintaining hydration is important, and patients should understand that it may take 2 to 4 days before they have a bowel movement. As you compare these medications, don't try to memorize every single side effect. Instead, ask yourself 3 questions. 1. What is this medication used for? 2. How does it work? And 3. What is the most important nursing consideration? If you can answer these 3 questions, you'll be able to apply your knowledge to almost any exam question or patient scenario. Remember today's nursing mindset. Every bowel medication has a purpose, but every medication also has a risk. Safe nursing care means choosing the right medication for the right patient, recognizing when a medication may do more harm than good, and always monitoring for both effectiveness and adverse effects. That's the nursing mindset. Keep developing yours.